Question 1. What is the first step a nurse must take before initiating any sterile procedure? A. Set up the sterile field. B. Perform hand hygiene. C. Apply sterile gloves. D. Open sterile packages. Answer: B. Perform hand hygiene. Question 2. A nurse is caring for a patient with a draining abscess. Which type of isolation is most appropriate? A. Droplet. B. Contact. C. Airborne. D. Standard. Answer: B. Contact. Question 3. When is it appropriate to use alcohol-based hand rub instead of hand washing? A. After using the restroom. B. After contact with C. difficile. C. When hands are visibly soiled. D. After removing gloves. Answer: D. After removing gloves. Question 4. Which item should the nurse discard in a sharps container? A. Soiled gauze. B. Used syringe. C. Foley catheter. D. Empty 4-bag. Answer: B. Used syringe. Question 5. A nurse is assessing a patient's surgical site and notes increased redness, warmth, and drainage. What is the priority action? A. Apply a clean dressing. B. Notify the provider. C. Document the findings. D. Continue to monitor. Answer: B. Notify the provider. Question 6. Which of the following is the most effective method to reduce the spread of hospital-acquired infections? A. Wearing masks. B. Using hand sanitizer. C. Hand washing. D. Using sterile gloves. Answer: C. Hand washing. Question 7. A nurse is assigned to a patient with pulmonary tuberculosis. What must be worn? A. Surgical mask. B. Gown and gloves. C. Face shield. D. N95 respirator. Answer: D. N95 respirator. Question 8. Which patient requires protective reverse isolation? A. A patient with COVID-19. B. A patient post-chemotherapy with neutropenia. C. A patient with MRSA. D. A patient with hepatitis B. Answer: B. A patient post-chemotherapy with neutropenia. Question 9. What is the most appropriate action when a sterile glove touches a non-sterile surface? A. Replace the glove. B. Wipe it with alcohol. C. Continue with the procedure. D. Double glove over it. Answer: A. Replace the glove. Question 10. What type of transmission precaution is used for pertussis, whooping cough? A. Airborne. B. Droplet. C. Contact. D. Protective. Answer: B. Droplet. Question 11. A nurse is changing linens in a patient with contact precautions. Which PPE is required? A. Gloves only. B. Gown and gloves. C. Mask and gown. D. Face shield. Answer: B. Gown and gloves. Question 12. A patient with suspected meningitis is admitted. What is the immediate nursing priority? A. Start 4 antibiotics. B. Collect a blood culture. C. Initiate droplet precautions. D. Administer analgesics. Answer: C. Initiate droplet precautions. Question 13. Which behavior shows a break in aseptic technique? A. Keeping hands above the waist. B. Touching the sterile field with ungloved hands. C. Opening sterile packages away from the body. D. Holding sterile supplies by the edges. Answer: B. Touching the sterile field with ungloved hands. Question 14. Which action helps prevent ventilator-associated pneumonia (VAP? A. Deep suctioning every 4 hours. B. Elevating the head of the bed 30 to 45 degrees. C. Frequent oral rinses with water. D. Avoiding any oral care to reduce contamination. Answer: B. Elevating the head of the bed 30 to 45 degrees. Question 15. A nurse finds a biohazard bag leaking. What should be the immediate action? A. Double bag using a second biohazard bag. B. Discard it in the regular trash. C. Place it in a paper bag. D. Continue using it until full. Answer: A. Double bag using a second biohazard bag. Question 16. Which is the best method to prevent cross-contamination during patient care? A. Wearing 2 pairs of gloves. B. Using the same stethoscope for all patients. C. Using patient-dedicated equipment. D. Cleaning the room once per shift. Answer: C. Using patient-dedicated equipment. Question 17. A nurse needs to transport a patient with a draining wound to radiology. What should the nurse do first? A. Notify radiology of contact precautions. B. Apply a surgical mask to the patient. C. Cancel the transport. D. Place the patient in an N95 mask. Answer: A. Notify radiology of contact precautions. Question 18. Which is a recommended action during a sterile dressing change? A. Touching the sterile field with bare hands. B. Opening dressing supplies with clean hands. C. Using sterile gloves to handle sterile supplies. D. Pouring solution from any height. Answer: C. Using sterile gloves to handle sterile supplies. Question 19. Which patient statement requires further teaching about infection prevention? A. I should wash my hands before eating. B. I can reuse a tissue if it looks clean. C. I need to cover my mouth when I cough. D. I should avoid touching my eyes with unwashed hands. Answer: B. I can reuse a tissue if it looks clean. Question 20. A nurse is preparing to remove PPE. What is the correct sequence? A. Mask, gown, gloves. B. Gloves, gown, mask. C. Gown, mask, gloves. D. Gloves, mask, gown. Answer: B. Gloves, gown, mask. Question 21. Which of the following is the best strategy to prevent surgical wound infections? A. Applying warm compresses post-op. B. Using sterile dressing change technique. C. Encouraging frequent ambulation. D. Delaying dressing changes. Answer: B. Using sterile dressing change technique. Question 22. A nurse observes a coworker using the same gloves between patients. What is the priority action? A. Report to the nurse manager. B. Educate the coworker privately. C. Notify infection control. D. Ask the coworker to use hand sanitizer. Answer: B. Educate the coworker privately. Question 23. What is the appropriate action when a sterile field becomes damp during a procedure? A. Continue using it. B. Cover with a clean towel. C. Replace the sterile field. D. Dry it with gauze. Answer: C. Replace the sterile field. Question 24. Which of the following tasks can be delegated to a UAP for a patient on standard precautions? A. Sterile dressing change. B. Assisting with hygiene. C. Teaching hand hygiene. D. Administering medications. Answer: B. Assisting with hygiene. Question 25. When is it appropriate to use a face shield in addition to a mask? A. During a routine physical exam. B. While feeding a patient. C. When there is risk of splashing body fluids. D. When entering a protective isolation room. Answer: C. When there is risk of splashing body fluids. Question 26. A nurse is preparing to enter a room with droplet precautions. Which PPE is essential? A. Gown only. B. Gloves and surgical mask. C. N95 respirator and face shield. D. Hair cover and gloves. Answer: B. Gloves and surgical mask. Question 27. A patient with a pressure ulcer is found to have MRSA. What is the most appropriate precaution? A. Standard precautions. B. Contact precautions. C. Droplet precautions. D. Airborne precautions. Answer B. Contact precautions. Question 28. What is the correct method to break the chain of infection at the portal of exit? A. Wearing gloves during contact. B. Isolating the patient. C. Administering antibiotics. D. Disinfecting the room. Answer A. Wearing gloves during contact. Question 29. A nurse is educating a patient on respiratory hygiene. Which statement indicates understanding? A. I will cough into my hand. B. I can reuse tissues if they are dry. C. I will cough into my elbow or tissue. D. I should avoid hand washing after sneezing. Answer C. I will cough into my elbow or tissue. Question 30. What action is most important when collecting a wound culture? A. Collect after applying antibiotic ointment. B. Use non-sterile gloves. C. Clean wound prior to collection. D. Touch outer wound edges only. Answer C. Clean wound prior to collection. Question 31. The nurse is preparing to insert a peripheral 4. What infection control measure is essential? A. Don sterile gloves. B. Use sterile saline to clean the site. C. Perform hand hygiene and don clean gloves. D. Wear a mask and gown. Answer C. Perform hand hygiene and don clean gloves. Question 32. Which precaution is required when caring for a patient with infectious diarrhea? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Protective isolation. Answer C. Contact precautions. Question 33. A nurse notes a blood spill on the floor. What is the appropriate cleaning solution? A. Soap and water. B. Isopropyl alcohol. C. 110 bleach solution. D. Vinegar and water. Answer C. 110 bleach solution. Question 34. What is the best way to prevent cross-contamination between patients during vitals assessment? A. Use the same thermometer with alcohol wipes. B. Assign dedicated equipment per patient. C. Wear 2 pairs of gloves. D. Perform hand hygiene once per hour. Answer B. Assign dedicated equipment per patient. Question 35. A nurse should change gloves in which scenario? A. Between 2 unrelated tasks on the same patient. B. Every 8 hours. C. Only if visibly torn. D. Before leaving the patient's room. Answer A. Between 2 unrelated tasks on the same patient. Question 36. A UAP is about to provide oral care to a patient on droplet precautions. What PPE should they wear? A. Mask and gloves. B. Gown only. C. Face shield only. D. None needed. Answer A. Mask and gloves. Question 37. Which is the most important infection control measure in an immunocompromised patient's room? A. Use of negative airflow. B. Fresh flowers at bedside. C. Visitors wearing masks and hand washing. D. Allowing pets in the room. Answer C. Visitors wearing masks and hand washing. Question 38. Which of the following requires reporting to infection control? A. A nurse refusing to wear gloves. B. A minor wound on the patient. C. A surgical wound with serous drainage. D. Patient coughing without fever. Answer A. A nurse refusing to wear gloves. Question 39. When is it necessary to double bag contaminated items? A. When transporting linens to laundry. B. When outer bag is visibly soiled. C. When trash is from a surgical unit. D. When patient is on standard precautions. Answer B. When outer bag is visibly soiled. Question 40. What is the best prevention against catheter-associated urinary tract infections, CAUTIs? A. Irrigate catheters daily. B. Insert catheters routinely after surgery. C. Limit catheter use and ensure proper care. D. Use antibiotics prophylactically. Answer C. Limit catheter use and ensure proper care.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!